I'm talking today to acupuncturist Ulli Wiesmann. Hi Ulli, how are you?
Hi Joanna, I'm good.
Very good to hear. Ulli, today we're going to talk about one of the techniques that you work with, which is Trigger Point Acupuncture. What is Trigger Point Acupuncture and what is systemic Trigger Point Acupuncture?
Okay. I mean, it's probably best to understand what a trigger point is. A trigger point is a dysfunctional spot of musculoskeletal soft tissue, which means a muscle, tendon, ligament. The dysfunction is that this trigger point lost its ability to relax. The trigger points cause a variety of problems. They cause local and referred pain, they cause lack of strength and a limited movement range, or sometimes even numbness.
Okay, so when you're using the trigger point or the systemic trigger point acupuncture, how would you work or what would you do to try and rectify the problems?
Well, you use a very, very gentle needle technique. That's very important in this context because you're dealing with kind of quite tough tissue. And this needle technique is called precise density needling. And you very, very slowly and carefully insert this needle into the core of this spasm. There, it relaxes this spasm, allows blood to penetrate the area and stops the trigger point from reforming or reforming in the same intensity.
What can someone expect to happen in a treatment, and how many treatments do people generally need?
Well, I mean, I would ask you to bring any previous diagnostic materials like X-rays or MRI scan results. Then I would like you to tell me about your pain or demonstrate in which posture or at what movement the pain occurs. Then there's quite a lot of manual touch diagnosis. First, I would look for relevant tension lines, for example, neck, shoulder, elbow, lower arm, fingers, and then I would use my fingertips to actually find individual trouble or trigger points and identify them and treat them.
What happens with the pain after I stop having the acupuncture? Or do I need to keep having regular treatments?
Well, if you're quite healthy, the pain should simply disappear. It's quite important to identify what caused the pain. For example, if your screen is sort of on your left, then it's very good to kind of put it in the center if you work on computers. And it's also important to sort of work on your general stress levels and so on. If you've got very degenerative conditions of the spine, for example, you might need refresher treatments, but the general idea is that once you kind of completed your course of treatment, you're actually kind of free not to see me anymore.
Excellent. Ulli, what is the difference between trigger point acupuncture and traditional Chinese acupuncture? And do you ever find the need to combine the two techniques?
Well, traditional acupuncture works with qi, meridians, and acupuncture points. Its main objective is to establish balance in the body, whereas trigger point acupuncture is quite a specific treatment to repair musculoskeletal soft tissue, to eliminate pain and restore mobility. There are quite a lot of conditions which really benefit greatly from combining these two methods. I mean, for example, migraines, asthma, heart conditions, chronic inflammatory conditions of sorry, you just went there for a second. Chronic inflammatory conditions of the colon and so on. And the results are very, very good. But they can also be applied separately, these two methods.
What will I actually feel during the acupuncture treatment?
you feel quite a deep state of relaxation in terms of trigger point acupuncture. And hopefully, either directly after the session or after a course of treatment, you actually feel your pain is gone and you can move much freer and have more strength in your body.
Thank you, Ulli. Thank you so much for talking to me.
You're welcome.